Okay, now we're going to show some special procedures used in evaluating the toddler to preschool age child. When you walk into the room, the fact that we're an adult and they're a child may be an intimidating factor for them. Plus, we don't know what kind of experiences they've had in the past. So some of the things that are important to keep in mind is that you want to make yourself small. This gives the child the chance to, you can interact on their level, kind of at their eye level, and they don't feel quite as afraid that way. And also you want to keep a safe distance from the child. This gives the child the opportunity to evaluate me and kind of give him an idea if I'm a safe person that he wants to interact with. And another important thing to keep in mind that in this preschool age group, these children are very modest. So it's important to try to keep them covered as much as possible. Now on your initial approach to the child, you want it to be a slow, smooth approach. You don't want any jerky, sudden movements. And you want to make sure that you interact with the patient as well as the parent. Zach, how are you doing, buddy? Well, good? Sort of? Not really, right? Okay. Well, I'm just going to do some special examinations on Zach that'll emphasize some differences in the infant and also emphasize some procedures that can be utilized if you had a child that wasn't very compliant. So with the pre-age school or preschool age child, you want to start distally. So Zach, let's bring your legs down, buddy. And what I would do, I'd just be doing an evaluation of Zach's skin. And as I'm examining each portion of his body, I will be examining that portion of the skin as well, looking for any lesion formations. While the child is sitting on Dad's lap, we could go through some strength tests where, just quickly demonstrate. Zach, push against me, buddy. Push your legs out. Good. Now pull them together. Pull your legs in towards you. Good. And that's just some simple strength testing that we can do while the child is actually sitting on the parent's lap. And again, I want to emphasize that you will begin distally, working towards the center of the body, leaving the head, the eyes, ears, nose, and throat for last. Okay, Zach, I'm going to listen to your heart. And this is my stethoscope. This is what I use to listen. You may have used this before. Have you ever seen this? I bet you have. Okay, so I'm just going to warm this up a little bit, and I'm going to start off by listening to your heart. Now, would you like to lift your shirt up for me? No? Okay, that's fine. That's no problem. What I'm going to do now with Zach, I'm just going to put the stethoscope beneath the shirt, again using the acronym of Pretty Tough Murmur, listening to the aorta valve. Good. Pulmonic. Let's just sit up for a minute. There, great. Tricuspid, and the mitral. Okay, great. And while I'm here, I'm going to go ahead and listen to Zach's lungs. Starting high on the right side. Zach, taking a breath for me, sweetheart. Good. That's great. And again, we'll use a side-to-side movement. Great. Side-to-side movement so we can compare breath sounds. And we follow the same procedure we did evaluating the infant to make sure that we cover all regions of the lungs. Now to evaluate Zach posteriorly, again starting high at the apex. And we'll go side to side. Zach, taking a breath for me. Good. Mid. Left lower lung field. Good. Right lower lung field. And again, listening to the lateral. Deep breath in for me. Good. And sometimes you see it takes a little work to get everything done. Taking a breath for me, Zach. Okay, thank you. Now what I'm going to do, just as we did with the infant, I'm going to go ahead and while I have my stethoscope, I'm going to go ahead and listen to the bowel sounds in Zach's belly. What'd you have for breakfast this morning? You don't know? Nothing? Well, what kind of dad do you have? All right. Well, normally a good dad would feed his kid Cheerios or something for breakfast, so then I could listen for Cheerios in Zach's belly. Again, we want to emphasize the all four quadrant approach, right and left upper, left and right lower. And since this child is starving, we'll probably feel for nothing in his belly because his daddy didn't feed him any breakfast. But you can just use a soft, tender approach to the belly. Now normally you'd rather have this done with the child laying on the table, but some children don't feel comfortable that way, so to evaluate from the father's lap or the parent's lap is fine. Okay, good. Okay, now we're going to move on to the HENT portion of the examination. Again, we would do a red reflex with the child, and I've already demonstrated that with the infant, so we don't have to demonstrate that with Zach. So we're going to move on to the nose, ears, and throat. Zach, have you ever seen this before? Oh, yeah. This is my magic light. You want to hold it? It's important to let the child examine. Go ahead, sweetheart. It's important to let the child examine the equipment. Why don't you use it on Dad? Put the light on Dad. Good. Now that's my same magic light that I'm going to use on you, okay? Okay, let's go ahead and let's take a look in the ear. And I want to demonstrate a special hold that you can use on children who aren't being very cooperative. As you see that Zach is sitting on his dad's lap. He has his legs between his legs, so if he was a kicker, he could bring the legs together to restrain the child that way. We're basically doing this to make sure that this is a safe environment for the child so that I don't injure the ear when evaluating the tympanic membrane. The arms are in front. Dad's holding the child across the child's chest, and he has the head braced firmly against his chest, holding onto the head. And then with the child 3 years and older, you want to gently pull up and back on the pinna to evaluate the tympanic membrane. And this usually tickles, so this is the portion they really don't like. Pulling up and back. Good. All right. He has a normal tympanic membrane on that side. I think I saw X-Man in there, but I'm not sure. I think, well, let me check this here. Again, we repeat the same hold, pulling up and back gently on the ear for a child 3 years and older, and then we can safely and effectively, while I'm bracing my hand, evaluate the tympanic membrane. Good. It's important to use the bracing method because we want to be stable as well as the child. That ensures that the child doesn't get hurt. Okay, now we're going to go on and I'm going to examine the nose. So what we're going to do is have Dad bring the arms up. There you go. Head back. And what we're going to do with the nasal speculum, I would actually look up into each nostril, evaluating the nasal mucosa. It should be pink and moist. We look for any evidence of septal deviation. All right. Now, Zach, will you open your mouth for me? Say, ah. Good. You look for an upper normal retraction of the uvula. Stick out your tongue for me. Move it side to side. Okay, that'll work. Teeth are in good repair. And you're looking for pink mucosa, checking for any abnormal enlargement of the tonsils. Okay. Now we're going to do some musculoskeletal evaluation. Okay. Okay, Zach, we'll have you come up here for me, please. Stand right here beside me. This way. Feet together. Good. All right. Put your hands out in front like an elephant snoot. Now bend over. Good. You just want to hold on to the child, and what we're doing here, we're doing the spiny evaluation, checking in for any abnormal curvature. Again, we're going to palpate the spinous processes, and you can actually hold the child from beneath to give them stability. Okay, good. Okay, Zach, stand up for me. And I'm also going to assess the symmetry of height for his hip. Good. Symmetrical hip height. Now, Zach, what I want you to do, I want you to walk forward for me. And here we're just doing a simple evaluation of the musculoskeletal function. Okay, now can you walk back on your toes for me? Good. How about your heels? Can you do your heels? Great. Can you walk like a duck? Show me how you walk like a duck. Ready? Down. And walk. Good. And this particular exam called the duck walk is real good to evaluate the musculoskeletal function of the child. That's good, Zach. We can go ahead and get up.